Welcome everyone, I'm your host Dr. Angel Velasquez and this is Sports, Medicine and Baseball. Today's episode is one that many players, parents and even coaches hear about it, but very few truly understand. When people talk about January 15 in baseball, they think about signing bonuses, contracts and life changes opportunity for international prospect. What rarely get talked about is what happened behind the scenes, the medical clearance process that determine whether a deal actually become official. A verbal agreement doesn't mean that a contract is finalized. Every signing must pass through a detailed medical evaluation. And for that reason, today we have a certified athletic trainer, Patrick Serbus, who has been in Major League Baseball organization for the last 25 years. The last 15 years, he was with the Cincinnati Reds. And we will talk about this January 15 in baseball, what the MLB international signing process go through, and what teams are looking for, what raises red flags, and how players and family can prepare for this important day. Because on sports medicine and baseball is where baseball meets sports medicine. Stay with us. Nice, okay. Welcome, everyone. We're going to be talking today about Major League Baseball International Signing Day that is on January 15. And today I have a good friend of mine, a person that I admire, a person that actually helped me when I was starting in baseball, Mr. Patrick Serbus, an ATC who has been in Major League Baseball for the last 25 years and he's been in the Cincinnati Reds for 15 years. So, Patrick, welcome to the show. Tell me how you doing.
I'm doing great, man. Thanks for having me. Good to see you again.
Hey, good to see you. You're looking great, man. You're looking great. You look slim. You look in shape. I like it.
Thank you. Thank you.
So Patrick, before we talk about January 15, tell me a little bit about your background and correct me if I was wrong with my introduction too.
Well, no, you're spot on. I have been an athletic trainer in pro ball now for 25 years. I spent the first 10 years or so working as a clinical trainer, or what I would call being in the dugout on a regular basis with affiliate teams. I was with the Tigers and then the Giants and then the Diamondbacks before joining the Cincinnati Reds. My time with the Reds over 15 years was kind of an evolution of different roles, working with the rehab group, but largely working in a management and leadership position, running the department or helping run the department at times. And so the last 8 years or so being in a director position where my position was just to oversee and craft the department direction and staffing and so on and so forth.
Well, I tell you something. When I started there, that was around 2010, and in 2011 was my first trip to Dominican Republic, and definitely you were there. And since then, we got a good relationship because for me, a physician can do everything, and like in any job and anything, you can do everything. So we need to be working hand in hand or side to side with people like you, with athletic trainers that are passionate about what they do and are really, really good communicators. And that's one of the things that I learned from you. I learned from you being available. I learned from you being a communicator. And I really appreciate, all those 9 years that I was with the Cincinnati Reds, that I was working with you. Was a pleasure. It's one of the things that I miss the most, man. We talk about this all the time, and I miss that commodity, that communication, that maybe not day to day, but for sure 2 or 3 times a week conversation, and obviously those trips down, taking care of these young kids in Dominican Republic that we did, and in Arizona. So, talking about January 15.
Yeah.
Tell me what you know about it. It's an international signing period. So tell me a little bit about it.
I mean, the international signing date is an arbitrary date assigned by Major League Baseball, but at the end of the day, the difference between an international player and domestic player, they are essentially on different plans as they enter the professional ranks. And an international prospect gets lumped into a signing class, much like in the United States, you would see a school child being lumped into a certain grade level based on their age or their birthday. And so every year there's a new group of eligible signing players in a signing period or a signing pool. And those players are all scouted by the different clubs and um, uh, essentially attracted into contracts through negotiations and dialogue through various scouting departments and so on and so forth. So um, by and large, the talent pool is known commodity to the majority of the scouting departments. There's not a whole bunch of unknowns out there, but in the broad stroke, the big definition of the international signing period, most of our player prospect pool comes from the Caribbean countries, predominantly Dominican Republic and Venezuela, but many of the others down the Caribbean. But it doesn't uh, uh, discount the players that are available across Europe, Australia, Asia. They all lump into what is the international signing period or signing class. And so, um, the depending on how you look at this, I think most of our conversation today will be focusing kind of on more of the pool of candidates that we get from the Dominican and Venezuela as the lion's share of our prospects. But what will end up happening is if we have a prospect off in Germany or Australia, we'll repeat a lot of the things we'll talk about today, but on a one-off basis all the way across the globe, and that makes it a lot more difficult to achieve.
No, I can imagine, you as a organizer and a person who is trying to, to get this set up, especially after, a deal is made and a physical examination need to happen for that deals to go through it. Tell me how the medical evaluation start. When it start into this process?
Well, I think some of the stuff that is important to note on the international signing period is the age group of the player pool, right? The prospect pool is allowed to sign at the age of 16. So that means the prospect, the scouting process begins on these players much earlier than the age of 16. So our scouting departments
Hmm.
are down there watching showcases, watching tryouts, watching workouts and games for players when they're fairly young. And so when it comes to medically speaking, the things that are important is a couple of glaring items versus what we would typically see on our domestic side player pool that signs through the draft as their methodology of arriving to pro ball. And that's that since they're minors, the first thing we need to make sure we have is parental authorizations and clearances signed off on for the parents to say that we can do evaluations, we can complete
Hmm.
testing, and so on and so forth. On the U.S. side, when we see players, they're typically 18 and they're able to sign off on their own authorizations and so on and so forth. Um, the other thing that's a big thing to note is that the player age and the player pool that we're dealing with internationally, usually these guys are skeletally immature. They're still growing.
Hmm.
Uh, Generally, as a whole, they're underdeveloped or in some cases even malnourished, depending on what country they're coming from and what their home life situations are. And we end up just having to make sure that we evaluate them through a different lens based on those caveats. Um, Typically, we will see our top prospect in the pool somewhere close to a year prior to the signing date. So, right after they're turning 15, we'll first get our glimpse at them from a medical standpoint. And
Hmm.
that's prior to their signing window. So this is pre-signing. And during that time frame, each club is allowed a certain amount of time to try out players, to bring them to their complex, to work them out on the field, um, run them through some of these assessments that we're going to talk about, do strength and conditioning testing and things of that nature. So um, we only get them for small windows, and that time is spread out generally over a couple of different touch points during the course of the year prior to signing period or prior to the January 15th deadline. Um, and that usually means that we have the opportunity to see them on a couple of occasions to establish
Hmm.
progress or changes or things that have occurred during the course of that age of 15. Um, but again, the scouting pipelines where prospects are being evaluated start early, and the pools are established through that birth date as established by Major League Baseball. Medical considerations arrive on the scene much later down the road in their prospect or their scouting pipeline, and we really get a small amount of time with them before we make our decision.
Yeah, I remember those times that, obviously we had those guys for after they have, January 15. And the case when I was there was July 2nd. And, we had those guys and we evaluate them. And it's not just doctors and ATC. We're talking about strength conditioning. We're talking about some primary care physicians. We're talking about, people from lab, from blood testing. We're talking about, nutritionists, and sometimes even sports psychologists that used to come and do all this work for us or for you, because you're the one organizing this. And it's really important because without all those people together, we don't know these kids, right?
Yeah.
So having all this together and being able to communicate with them, at least for me, having a bilingual ability, that especially in Dominican Republic, that definitely helped and made them feel comfortable. So, tell me what kind of testing after the person is signed, or at least verbally signed, verbally agree with contract. What is the typical images or pictures that you get initially?
Yeah. Well, I mean, going back to what you just said, my role in this whole thing is kind of like the glue of just bringing the pieces from all the other specialties and expertise of people in our organization that had the opportunity to have touch point with the player. And to your point, strength and conditioning coaches, our wellness or counselors, our physicians, contracted services outside like imaging facilities, lab work, et cetera, et cetera. So my job is really just to kind of glue it all together and give a snapshot assessment of all of those things. For us, a physical process for a prospect, a comprehensive exam would begin with parental consent. Then following that, we end up with the ability to obtain a full orthopedic, internal, and family medical history, trying to get as much accurate information as reported by the prospect and their family. There's a lot of things, especially in Latin America, that go underreported or underappreciated versus what you would see in the United States. That usually, if they are completing that with full transparency, has some information on there that we can make some interesting decisions off of there alone. Drug test screening is usually one of the first things that is completed, and that's part of the pre-signing requirements from Major League Baseball. That's not something that we specifically do as a medical part of the exam, but certainly part of what they will undergo as they step through the process. As for the things that we will outline and try to complete on all of our signings, but certainly all of our top prospects, will be lab work for internal medicine review, a comprehensive survey panel of basic chemistries and metabolic functions and so on and so forth.
Important for these guys, these players, because of the, malnutrition or malnutrition or, diabetes, undiagnosed, thyroid, all these other conditions that somebody can have, even autoimmune condition that can come that nobody knows about it.
Yeah, underappreciated things again, sickle cell traits, things of that nature. There's a lot of things. Even sometimes it's the first time they've been blood typed or something of that nature. So there's a lot of things that we find out, vaccination statuses, things like that. So imaging baselines that you asked about, we would do x-rays of all the major joints and the low back, looking for gross bony pathologies. We might actually get x-rays on a body part that wasn't one of those major joints if they had a pre-existing or reported injury history that we knew about, or something that we flagged on our own exams. We might follow up with further imaging. Typically, we would get MRIs on their throwing shoulder, dominant shoulder and elbow. Um, Again, if there was a known injury on another joint, or if there was something that was flagged based on our exams, we might get an MRI follow up on something else, dependent on kind of how things felt on the exam and what their docs thought about things as we go through the process of reviewing. Um, with the Reds, when we were doing it together, we also ran a dynamic ultrasound on their throwing elbow and evaluated the ligament quality and the amount of joint play and gapping that their ulnar collateral ligament allowed for on a live exam, whereas the MRI is more static and the X-ray static. The dynamic ultrasound gives us a moving picture, kind of a qualitative assessment of how their joint stability is on their throwing elbow. Um, outside of that, then we get into more our hands-on testing and so on. We get a head-to-toe physical survey. We really go through some basic movement assessments, scap screening, trunk rotations, flexion, extension, hip mobility, things of that nature, and then really spend a lot of time looking at range of motion of all the major joints, manual muscle testing of all the major muscle groups and those major joints, and then a really solid once through on all of our special testing for pathologies on shoulders, elbows, hips, low backs, things like that. I always took postural pics, 3 views, an AP front on, and then one side facing each direction. And that gave me an opportunity to compare them serially. If I saw them a year ago and I'm catching them up again almost a year later at their signing date, I had the ability to actually look back and see what these guys, how they changed. And quite often it was a dramatic shift. The completion of all of those tests is really just putting data points down, right? We have all of this information, but at that point, they still haven't seen a doctor. We still haven't made any assessments. There's no giant leaps as far as what we see about a player or what we think about a player. It's just gathering information and putting it together. At that point, then the physician has an opportunity to do an exam. I always did a clinical exam myself during the course of that head-to-toe survey. And so it was always good to be able to have multiple different clinicians have hands-on and compare concerns or lack thereof. Sometimes when you're going through an exam and you've got 30 guys lined up, you do things a little bit quicker, and somebody else comes along and does that same exam and has a better quality or spends a little bit more time perhaps and gets a better feel for something. And it's good to have conversation about what different clinicians are seeing on a clinical exam.
And that's something that is really important. That's the explanation or the way that I see things, how we complement each other in that. Like at the end of the day, there was a sitting time, or the next morning, there was a sitting time where we discuss all these players. You guys discuss for the ATC standpoint, strength condition for the strengthening standpoint, and then we kind of get together and tag team and make a decision about, hey, let's discuss what tests we need to be done. I have my notes, you got your notes, and we all just made a decision. And the importance of this is obviously there is a reason for the contract, right? This contract, when we go into this contract, not for us as a medical personnel, but for the organization, our job is obviously looking to see if there's, anything that is being pre-existing at that time. And not just for my way of thinking in the contract, but to know these players, because most of them, we will sign them. Most of them, the organization, we take care of them, but we have to have a plan from when they're signed at 16 years old to their process, how we can get them where they're supposed to be when they go back, when they go to the States, and then they go into their climbing all the way to the Major League Baseball. So it is so important for taking care of these players, and it's something that is a role that goes underappreciated, and people don't know about it. That's one of the reasons why I want you to be here, because you did this for a long time, and you did, really good, and teach a lot of people how to do it the right way. So, what? Obviously, we talk about the role together, but what specific role the athletic trainer has? If you have to tell your athletic trainers out there that is looking to go to, professional baseball, and maybe starting into the minor league and going to the Dominican, or, to Venezuela, other countries, tell me, what is your role? What is their role? And what is your advice for them?
As it pertains to the physical process, or as it pertains to working in professional baseball?
I think working in professional baseball, and obviously taking care of this guy, because they are the eyes, they are the hands of everybody here in the States when they are down in Dominican Republic. They have players from Venezuela and they have players from Dominican Republic. And the rest, we have two teams, right? At that time, at some point. So, why you recommend, what is how you will explain the role that they have, and, and what they have to look for when they're down there?
Yeah, I mean, well, there's two different ways of looking or approaching the physical process. Like, one is assessing a player's current physical condition, and another one is establishing benchmarks or baseline on what they're capable of at that given moment. And as it pertains to any player, whether it's an international signing deadline of January 15th, or a drafted player on the state side, or even a returning player from year to year in a spring training physical, we're looking for data points of progress or regression, and that gives us the ability to create maintenance programs and or corrective programs and interventions and things that are going to keep them healthy and hopefully on the field. And so recommendations for athletic trainers is to make sure that they look at a physical process as more than just a liability check off, if you will. It certainly is a liability exercise from the standpoint of a physical clearance to participate in sport, but the larger and probably more utilized portion of it is the information that allows you to get to know your player, and then how to intervene with your player, right? So I think
that
go ahead.
That's fantastic there. I think that's a good point that you made there, that sometimes people do things repetitively, or maybe with the scare of something, with the responsibility of medical clearance. But at the end of the day, we're talking about taking care of another human being, another person, another opportunity for a career that is our job, is our responsibility to take care of it, and see them not just as as another player, see them as a person, see them how they are, see them who they are, know them really well, and that's a good way to say it. And I really appreciate that answer, because that describes, how I know you, how I know who you are as a person. So, what advice you have for, players and families out there, obviously in these different countries, to what advice you have for them to this process? How important is good communication and the trust between the organizations and the families and players? So when they're filling all this paperwork, obviously they don't want to say everything that happened on their life, but at the same time, major moments are important, because at the end of the day, we will do our physical exam to try to figure out and find out.
Yeah, I mean, I think there's a definitive difference between business and the medical side, right? Like on the scouting and business side, where they're negotiating a contract structure, how much they're going to sign for. That's kind of separate from what we're looking at and how we're looking at it on the medical side. Now, I'm not going to say that they don't take our information and consider those things as it pertains to the business side, but when we're asking questions and we're trying to figure out things about a player, we're not doing it from the lens of trying to affect change on that negotiated contract structure or whatever. I never really cared to know exactly how much a player was signing for, or what the status of a player was prior to getting to know them. If they had 15 players that showed up on a day, I would do all of the exams the exact same. I certainly the outcomes would be different, and the level of interest on certain players is different based on their prospect status. But that's something that doesn't affect how we approach the medical side of it. There's no doubt that there's some uh, gaming that goes on, I guess, in the process where players will try sometimes to hide things from us or whatever. And as we've talked about in the past, I've always felt like I'm more of a detective often than I am a clinician that's trying to help somebody. Very rarely does a player come into a signing medical physical and say that they're there with a problem and they'd like to have it evaluated, which is typically what you would see with your patient in a clinic, right? They walk into your office and they have a complaint, and you evaluate it and you think of how you can help them with that complaint. And that's not the model that we work with in the world of baseball medical signings. Usually it's they know they have something that's bothering them, but they don't really want to talk about it because they perceive that as being something that will ding their status and potentially their signability. And while I suppose there is some reality to that potential, but I don't think that's the way that we view it as priority one. So advice to the family is simply from the standpoint of what we're looking at, it helps us to have as much information as possible, and know that our job isn't intentionally to go out there and renegotiate contract structure that's already been discussed between the scouting department and the family of the player. Some of the things that we run across with families is that they have agreements with agents, and the child has been away from their family for a while at a agent's training academy. And so sometimes they just see their kid on touch points, much like we see them. So that's where the scouts needing to have relationships with the agents comes into play at times as well. Our goal is, again, to assign a medical risk score, if you will, to a player so that our scouting department can know what they're contending with, but also establish baseline measures so that we can come up with programming that will help them in their journey to play baseball professionally. Oftentimes, I think we didn't do a good job of this early on, and then we brought in some personnel to the structure that was more integrated into talking to the families and talking to the parents and letting them know what was going on. And I think that is an underappreciated aspect of it. And that's, part and parcel of why you're trying to do this podcast is to inform parents about what they can expect and what our intentions are with their kids, right? But I think that the business topic is not a discussion that we have on the medical side. Let's just say worst case scenario on a medical exam, we come up with a major red flag and something that we feel strongly would likely be a surgical candidate or something of that nature. Our goal is not to disqualify people as a intention. Our goal is to establish what needs a player might have, and if there is a significant issue like a surgical need, that might be something on the business topic discussion that they would just simply say, all right, well, the club would incur a certain dollar amount to fix this problem on surgery and rehab, and that might be something they would go back and renegotiate potentially. But that's, again, not our primary goal in the process.
No, absolutely, I agree. I don't remember. I don't remember knowing, players' bonuses before I was able to evaluate them. Maybe at some point through the process, maybe high tiers at some point. I just don't remember of my mind. So it doesn't mean that I never knew it. It's just that I don't remember. But definitely it's not our main goal. Our main goal is actually, get a group of medical personnel who can evaluate appropriately and know these players, make them feel comfortable, so they can share with you, if there's anything going on with them, so we have a better idea. Because at the end, they're children. You're talking about
Yeah.
16 years old, underdeveloped. Growth plays open. Injuries are different than the guys that we see, in the draft, because they're already, 18 or older than that, and they're already grown off men, and it's different. It's a different population, and you need to treat them different.
There's no doubt. The other thing that comes to mind, if you're talking about recommendations to parents and families of these younger kids, there's a lot of effort put on focusing on baseball and performance side of things. And I think that it gets lost sometimes on the fact that they're trying to prepare kids for a level of baseball that is development wise above where they're currently at, right? So
hmm
long-term planning and preparation for what they're going to need to be successful at the level of pro ball, they need to really be focusing on things like nutrition and strength and
hmm
conditioning and really workload management. It can be parents should be wary of showcasing and frequent high intensity tryouts and the ability to do those things multiple times a week or even sometimes twice in a day. Injuries do occur and they happen to particularly skeletally immature players more frequently. And they can be significant problems. Things like little league elbow and little league shoulder growth plate injuries are a real issue for adolescent athletes. So we don't see those things in pro ball because they're aged past our population at that point, but we see the aftermath of it at times, and we see a lot more of that out of our Latin American population of players than we do in our players on the state side of things. Um, you know, I don't know if I have a great recommendation as to how to go about managing workload, but I think that a parent should have input on how much their player or their child is showcasing, how much the agents are out there bringing them around to tryouts and so on and so forth. It can
Well,
because it
the
really
truth is
can
that
affect signability and opportunities that are available to them down the road. And we do see, and it's worth saying that this isn't just an international player pool issue. We do see a lot of pathologies and whatnot in high school athletes on the domestic side as well. And it's just overuse work and the aftermath of things like perfect game tournaments and adolescent competitive sports outside of what used to just be a high school competitive schedule.
Yeah, I obviously that changed a lot. I have a 14-year-old, kid at home right now that, is playing baseball, and making that decision between what level you go, how high you go, traveling ball, not traveling ball is, where you take it for developing instead of just trying to win games and being there. So it is a fair line, and it's something that, is on a different level in different places. And in these, countries, it is more about an opportunity. When you talk about, Dominican Republic and Venezuela, they are coming with the most players in the, international signing. Because there's a more pool, and Dominican, how it is with developing and having baseball players, and the importance of them in their families, and important for them to trying to make it to support their families, support their community. There's it's a way of living, and it's important to understand that part, that maybe 16-year-old, they may be hitting 350 feet homers, and throwing 90 miles per hour, but they're kids still, and there's something that when we were there, we were able to take care of them. We're able to trying to know them. I see your interaction with the kids. Some of them call you, Patricio Servicio instead of Patrick Serbus, and this just a relationship. I think the team that you had there, working around you was fantastic. People will mention name, Sean Moran, Rigo. I remember Rigo, our Cuban friend. I remember, Brad Epstein and Morgan that is now, strength conditioning for the Philadelphia Phillies, and all these guys that went. Not to mention the one that were there all the time. That were there for a period of time through the year. Paying their dues and trying to them making it too and learning how to take care of these kids. So, we appreciate all your hard work. I really appreciate the way that you direct me. Maybe indirectly, maybe you don't know that you were doing it, but me as a 2010, 2011, I was a youngster. I was in the right place, right time. And I was able to get into professional baseball. That is, I'm passionate about the sport. um and you guys like you really mold me to be a better physician, to be a better person, and to be able to take care of these guys. So I really appreciate your time. I really I was excited to see you. It's been long time. I told you you look fantastic. This is a relationship between good friends, right? So you look fantastic. I'm more than happy to some point if you're around the area. I know last time you came to Cincinnati area we could not see each other, but next time you come around, or next time I get close to you, we need to get together.
Well, I appreciate the kind words. I think that you probably helped me more than I helped you, but I appreciate you giving me the compliment. And for sure, we'll get together again here soon.
Freeze and safe. Freeze and safe.
Freeze and safe. Freeze and safe.
For that there is my line every time I need a picture on my ultrasound. Is freeze and safe. Freeze and safe, or just safe for a video. So we got so many of those.
We get GE to give you a royalty for freeze and save, I think.
That's for sure. That's my ultrasound. That's for sure. Not to give it some credit. Maybe
this is all for today's episode. I wish the best for the organization and the players who are looking for that dream of playing in Major League Baseball. Remember, if you really enjoyed this episode, please subscribe and like, and let's see you next time.